Mr. Saravanan, who is academic officer as well as head of community activities at Acchutha Eye Care and Institute of Optometry, who's an alumnus of Saravanan University and Acchutha Institute of Optometry, who's going to talk about opportunities in community outreach activities. So, over to you, Saravanan.
I think I'm audible.
Yes.
Vanakkam, good morning, namaste for different parts of the audience of the country. And it's always a difficult task to, to talk in front of all your faculties. It's again, I'm sitting back like to a Viva session. And so all the stalwart has spoken before me. And now I'm going to touch up, I think the screen share. Just give me a second, I'll share my screen. Is my screen visible?
Not yet, Saravanan.
Not as yet.
Now?
Yeah, it's coming up.
Yeah.
Okay. So first of all, thanks to all my gurus who made me sit here and talk in front of you all, especially to Reiki sir and all my Saranya ma'am and Rizwana ma'am, everybody who has been here, who has nurtured me in all this career. So one of the thing which everybody will get into after bachelor's in optometry is what to choose next. So fortunately or unfortunately, everybody would have selected this optometry as our undergraduate program. But by the end of second year or third year, we might be thinking what we are going to do in further. Are we going to become an academician or clinician or what else? So we encounter only few different people in our curriculum, or we meet only few professionals in our experience, but we will not be knowing or exploring all other opportunities, what all we can explore. So now I'm going to specifically talk only about the opportunities which is available as a community optometrist. So when we speak about community optometry, everything, the moment when we speak community, everybody who are a young budding optometrist who think only about screening of cataract, if I'm not wrong. So there are a lot more than the cataract. So there is something called school eye health program where you limit your, as an optometrist, you can go on screen and you can do more. I'll talk everything in detail about next. And we can do a fundus evaluation, fundus retina examination, and we can do a cataract as previously mentioned cataract examination, glaucoma examination, and we can give a pair of glasses and which will make you more happy and make your job more satisfaction. So myself, Saravanan Subramaniam, who completed bachelor's and taking care of the head of community outreach services at Acchutha Eye Care and Institutions. So when we talk about community outreach, don't stick on only to cataract screening. Cataract is the bread and butter of ophthalmologist. As an optometrist, we can explore more in terms of community outreach. So we all know that we have three stages of this: is prevention, treatment, and rehabilitation. My chairman always says, we all, as an Indian clinicians, we all good at treating a patient. But are we doing enough in terms of creating awareness to the society? Are we doing enough in terms of preventing a disease? For example, you take a diabetes. Are we giving enough counseling chair time in the community area to make sure are they undergoing their diabetic eye checkup as and when required? No, we are not. We are lacking in that area. And are we telling all the patients who sees as a pediatric services, we are failing to tell all the students that squint surgery is essential and it is done free of cost under Tamil Nadu comprehensive Chief Minister Comprehensive Health Scheme. It's available in all the states of India. So we are the one as an optometrist who go and tell or talk to the patient that you have this, you need to go to an ophthalmologist or you need to go to an optometrist at right time to get this or treatment done. And how much corneal awareness we are giving in terms of corneal donation, or how much vitreoretinal services we are giving in terms of community outreach. We are sticking only to the cataract or better off pediatric services like pair of glasses. We have a lot more. It's like community outreach is going out of your comfort zone. You all have your sophisticated instruments at your hospital or at your institute. But when you go to community, I'm just pitching again, your skill will improve automatically more than the other skills, your clinical skills and your communication skills, and how do you behave with the patients, how your counseling skills, like how do you counsel and make the patient to drop to your institute or to hospital and make the treatment to be taken care by the patient. So that's how your communication skill, and because all the previous speakers has specifically focused on the communication skill, attitude, and the skill set of the optometry. So this skills is very important in your community outreach programs, because when you do a refraction at hospital, you'll be having all the sophistication examination, but when you do one community outreach, you need to undergo the retinoscopy for the patients, and for fundus you need to do ophthalmoscopy. So you need to be expertise in these skills. It will automatically improve when you do a community outreach. So I'm just talking about where all areas where you can focus. So when you wanted to hit community, you can directly hit the community by school eye health program. Like you can go to the school and get the permission approval, and you can do a community outreach program in the school and refer that child to a practitioner who is having their clinic set up. And if you wanted to collaborate with other researchers, like research, and you wanted to take that into publication, you can collaborate with the research associates, and that's how you collaborate. As a community outreach officer, you need not set up your own clinic, but you can start your own NGO, and you can start referring this patient to a base hospital where you liaised with. Either it can be an optometrist or an ophthalmologist, and same thing can be collaborated with the research associate, and you can pull up more papers and get more grants for doing the same service. In upcoming slides, I'll be telling what are the institution which gives grants and where all you can work as a community optometrist. And second point is clinical care system. We think community outreach, we go just check vision and we send, okay, cataract fit and not fit. No, not like that. In community outreach, you can do a lot as you do same in the clinic. You can do vision therapy, you can do orthoptics examination, you can do a consultation for what, the systemic diseases which can affect the eye eventually. So, and employers and business, like you wanted to screen for employers, like, ESI based employees, so that you can get their treatment free of cost. You can go and screen bus drivers, TNSCTC approval. You can go do a business, like they have a small business, they were 50-60 employees. You can do an industrial visit. You can screen their eyes there, and you can liaise with an ophthalmologist. It can give the report, or you can get the treatment done with there. And for example, you can do it with multiple medias. Like you need not require a clinic for this. You just have a social media. You publish all this in your social media, and just you get a lot of phone calls regarding the community outreach at their doorstep. And reaching the unreached should be the main target more than the commercial aspect. Commercial aspect should not be the primary motive of community outreach. Commercial aspect is the last motive of any profession you take. And this is basically done for non-profits. You cannot expect any profit out of this. This is more of service. And end of the day, if one child turns out 18 years old, and if he or she tells, I'm seeing today clearly because of you, it's a great job satisfaction you can have. And education sector, you can go and talk to different forums as an optometrist, like diabetic retinopathy counseling, glaucoma counseling, cataract counseling, awareness to the patient. Pensioner will not have any awareness on the diabetic retinopathies, so you can talk to them. And you can go to the diabetologist clinic, like morning 7 to 10. You can walk in with your ophthalmoscope. You can check whoever the glycemic level is uncontrolled. You can check their fundus without dilation, and you can refer those patients to your nearest ophthalmology clinic. And you can go and check with the government organization, like government agencies, like they have a national program of control of blindness. You can go and screen the diabetic retinopathy, glaucoma, cataract, corneal blindness, and the school health program, like Kalaignar Kannoli Kaappeetu Thittam. You can screen there, and you can evaluate their vision and give the glasses free of cost on the same scheme. Because a lot of governments lacks, Tamil Nadu governments lacks more qualified optometrists. And how I see this as an opportunity is, 10 years back, 2010, there are people who just 10th passed go and screen their eyes, but not the qualified optometrist. But now in 2022 era, lot of optometry qualified people are going and screening. So they take the decision making over there. They know which patient has to be referred, which patient has to be seen in urgent basis, which patient can be treated there itself. When I say treatment, it's a management there itself. So that is the opportunity for the upcoming optometrist. You can become famous in your local area by serving the community without investing 1 rupee. The investment is the time and your communication skill and your clinical skill. So where all you can get as an opportunity to work as a community optometrist day in and day out, you morning 9 o'clock, you go to the school or wherever they delegate, and you come back and you sit back and complete the data and give the treatment free of cost. Few of the organization, and I don't have any financial disclosure providing this data. Few of the organizations like Mission for Vision, Help Me See, and Seva.org, and CBM Bangalore based Site Savers. Aloka Vision program is by Zeiss and India Vision Institute, Standard Chartered Accountant, and this RBS International, and few have missed it. And these are the more predominantly they recruit more amount of community optometrists for their practice, and you can serve there. And as Rizwana Madam stated, you if you have a skill set, you join as a community optometrist and upgrade your skill, and you go as a regional optometrist for all those things, and you can become a regional manager for all these things, and finally you become the director or assistant director of all this decision making skills, so that you can organize n number of grant writing and you can attract grants from different organizations. So when you think you wanted to do service, definitely you need money for doing service. You wanted a good income for doing good things. So a few organizations which I would like to say is you have a lot of organization which will be giving funds like Tata Trust, the Reliance Foundation, and Aditya Birla Groups, and more of JSW Foundation, and a lot more. You can just you can find it in online sources which are ready to give funds to doing for conducting a community public health program. And you wanted to be a community eye care practitioner or community health practitioner is again a different question. If you wanted to be a community eye care practitioner, bachelor's in optometry is more than adequate. If you wanted to become a community health sector provider, you can complete your bachelor's, and if required, you can do a master's in public health. You can pursue that. You can come back to the society. You can do the same. So this is all I just wanted to brush through in community as a community optometrist. And one word I like to say, any profession you do, the job satisfaction is mandatory. In this community outreach program or as a community optometrist, I would like to say I have 100% job satisfaction by touching a lot of eyes where it has been not examined for a lot of years. And everybody comes to you, the world of explore what you can do is the low vision rehabilitation, because everybody would have undergone a lot of surgical complication or something like that. They would be coming with you with little hope that you might be doing something better than somebody else. In that time, small counseling and low vision rehabilitation will make you a good community optometrist. Thanks for the opportunity. I like to take up the questions if anything is there.
Thank you, Saravanan, for giving an overview about community optometry aspect